Hey guys, I'm JG the PT, and we're going to talk about our Master Reset with NeuFit. So the Master Reset is NeuFit's version on a vagus nerve reset. So let's break it down. The vagus nerve is one of your biggest nerves in your body, and it controls our autonomic nervous system, meaning it controls our parasympathetic and our sympathetic. So our sympathetic nervous system is that fight or flight and that stress response. This is when you have a high heart rate, high blood pressure, you are on edge, you can't really relax. This is where we see a lot of chronic pain, chronic tension, and poor movement patterns. So when you are injured or you're just stuck in this phase, we have your nervous system just can't get out of that. It's either not engaged or it's on high alert. So what we're trying to do is target the parasympathetic nervous system, which is your rest and digest. So that's calming effects. So this will lower your heart rate, it will lower your blood pressure, and it'll actually help re-engage your digestive system. You're shifting your body into that rest and digest so you can improve healing. We're not gonna be able to get any healing effects if you're constantly in this sympathetic fight or flight phase. So we're gonna take the Neubie and we're gonna target that vagus nerve, and we're gonna send signals to the base of the neck and to the bottom of the feet. So we're gonna target that whole nerve, and we're gonna send signals to the vagus nerve to try and re-engage so we can get into that parasympathetic nervous system. What this does when we do the Master Reset, it tells your body, hey, you're safe and you're allowed to relax and calm down. So let's talk about who would benefit from the Master Reset the most. Basically everyone. This is going to be those people that have issues with calming down, your chronic pain, chronic stress, chronic tension, our concussion populations. We have a research study going on right now with our concussions and Master Reset, so you can check that out on the NeuFit website. People who travel a lot, people who have high performances, people who operate at a high level. So think about firefighters, search and rescue, our policemen, our healthcare workers that are in the ER or in a very high stressful situation. This is for you. All right, now we're gonna walk through the demo and setup because this is very important for where you're gonna put your pads and how you're gonna place your patient. We have these really new, awesome butterfly pads that have been in the making for a little while. So traditionally, if you've been with us for a little bit, we used to use these circle pads, and we would place 2 of the circle pads at the base of the neck. Now we have this beautiful butterfly pad that is connected. So these are linked in the storefront, so you can get these shipped to you. But we're gonna take the butterfly pad and we're gonna put it as close to the hairline as we can. We really wanna be as high as possible on the base of the neck. So we're gonna take this here, move the hair out of the way, and we'll go right in the middle up here on the base of the neck. You can straighten out so we can see this here. What we're going to do while we're here, we're gonna take 2 channels, and we're gonna take the red part of the cords and put them at the neck. So red goes to the base of the neck, black goes to the feet. This is actually really important because the current is gonna go through the black first, so we want it to go through the feet and then up to the neck. This way, we're gonna be targeting that parasympathetic in the rest and digest. If you reverse this and you put the black at the neck and the red on the feet, you can actually excite the nervous system. So that might not be our target when we're trying to get somebody rest and digest. But if you're working with a stroke population or somebody where you're trying to elicit more of a muscular response or an excitatory response, that might be a time where you could put the black at the base of the neck. Rest and digest, we're trying to calm the nervous system. Red is gonna go to the base of the neck. We're gonna put this blue cord on the left, and we're gonna take our green cord and put the red on the right. And then we're gonna remember this because when we put her pads on the base of the feet, we're gonna make sure that our green goes to the right and our blue goes on the left. So you're keeping the sides in the colors the same. That's important, we're not crisscrossing. All right, so we have this here. We're gonna have our patient go ahead and lie down. Perfect. And then we're gonna take 2 of our rectangle pads and we're gonna put the black into those. So one here, one here. So we had green on the right. So we're gonna take our green black pad and we're gonna put it on the base of her right foot. Make sure it's pressed on really tight so they can feel it. We're gonna take our blue, which is on the left, and we're gonna put it on her left foot. These go right on the balls of the feet, that like fat pad, your met pad right here. If you are still using the circle pads or the butterfly, sometimes we take a little towel and we roll it up and put it on the base of the neck just for added pressure. So this is how your patient is going to be. What I like to do in the clinic is prop up their legs onto a little bolster or a foam wedge, and then we'll obviously make them comfortable with a pillow under the head. When you're looking at making your patient comfortable and making sure they can go into a rest and digest, sometimes I will have my patients use noise canceling headphones. If they want to listen to a meditation podcast, that's fantastic too. Some people want to listen to white noise or some calming, relaxing music. We'll let them do that. I'll also give them a blanket sometimes to keep them nice and warm because they will get cold. Sometimes when you're targeting that vagus nerve and you're going into that rest and digest, they can get that cold chill feeling. So oftentimes we'll use a blanket as well. You want to set your patient up for success and put them in the most relaxed position. If you're in a clinic setting, this includes putting them in a private treatment room, turning the lights down, and really making sure you're creating an environment for them to relax. For the Master Reset, we're gonna be on 500 Hertz. And this is actually important when you think about the intensity because typically like we're working on a 5 out of 10 intensity, but for the Master Reset, we actually want Submax. So I'm typically telling my patients, I want you at a 3-4. And what you want to make sure is happening is we don't want any muscle spasms in the neck. So if you're turning it up to a point where they're getting muscle spasms in the neck, it's too high. So we have to thread the needle of letting them feel it in all 4 pads without the muscle spasms in the neck. Sometimes if we have a lot of decreased neural connection in the feet or we're just not getting them in all 4, I will turn it up to a point where they can feel it in all 4 and then back down off the intensity so that we can get back to that Submax 3 out of 4. But this is really important because if you crank up that intensity, you're not going to get a true parasympathetic response of the rest and digest. So we're going to go up, Ellison, and I want you to tell me when you start to feel it.
Okay.
Feel it in the neck or the feet?
The neck.
Okay, tell me when you feel it in the feet. Is it too high in the neck?
No, I can feel it in the feet.
Okay. Is this a 3 out of 4 or do we need to go?
You can go up a little bit.
Is that better?
That's good.
Is that too much or are you okay?
No, I'm good.
So you feel it in all 4, but your muscles aren't twitching in your neck?
No.
Okay. All right, I'm JG the PT and that was our breakdown on the Master Reset. This is one of the most powerful core 4 tools of the Neubie. It's one of my favorites. I think it's important for everyone. And I'm excited to see you guys try it and let me know how it goes.